Hi, my name is Elizabeth Hartley Hall. I am a second year medical student at OSU College of Osteopathic Medicine, and today I will be sharing my presentation evaluating participant diversity gaps in atopic dermatitis clinical trials. And this is a systematic review and meta-analysis. Just as a little bit of background, atopic dermatitis is a chronic inflammatory skin condition that has pruritic erythematous plaques that can lead to an increased risk of cutaneous infection. Interestingly, non-white racial groups are disproportionately affected by atopic dermatitis, but they are underrepresented in clinical trials. There have been strides taken to try and increase clinical trial representation, such as the NIH Revitalization Act in 1993, which mandates that there is increased minority participation in federally funded clinical research. However, there are significant inequities that persist in racial and ethnic representation among clinical trials. In this study, we did aim to examine the diversity within atopic dermatitis clinical trials that had at least one center located in the United States. We synthesized existing literature and assessed participant demographics such as race, ethnicity, sex, and age, and we sought to quantify and evaluate their overall diversity of clinical trial participants. As for our methodology, we followed PRISMA guidelines for systematic reviews and meta-analysis. Title and abstract screening was conducted first, followed by a full text review prior to doing our data extraction. We did utilize Rayin, which is a systematic review screening platform. We then did our data extraction in a double-blind manner using a standardized Google form. Using that Google form, we captured trial characteristics and demographic information such as sex, age, race, and ethnicity. Participant diversity was then evaluated for each study using the clinical trial diversity rating framework that was previously employed by Agbula and Wright. To assess the diversity in atopic dermatitis clinical trials, we did use the participant to disease representation ratio, also known as PDRR, and the ethnic fractionalization index, EFI. Trials were included if their national or multinational EFI score was greater than 0.3, which ensured that the representation was from ethnically diverse populations such as that were reflective of the US demographic landscape. These PDRR values were calculated based on US population data and then were analyzed as point estimates for each demographic group, with our standard error derived from individual sample sizes. Now to go over results. Since we did follow PRISMA, we made a PRISMA diagram. So to start off, we had 347 records returned based on our search string. And after we went through our duplicate removal, our title and abstract screening, and our full text screening, we had 17 articles that data was extracted from. So these are the articles that are included in our systematic review and meta-analysis. As for our characteristics of included studies, we have here the sample size information, the number of centers that were conducting a clinical trial, whether it was a United States only or multinational trial, and then funding sources, intervention type, clinical trial phase, and if they were blinded or not. Overall, our analysis of 17 studies revealed a significant underrepresentation of non-white participants in atopic dermatitis clinical trials. Several of these studies showed statistically significant disparities. Black participants were particularly underrepresented, with a statistically significant deficiency noted in 8 out of the 10 studies where there was a PDRR less than 0.8. Conversely, our white participants were overrepresented in 12 of the 14 studies reporting the race, but this finding was not statistically significant. Additionally, our analysis highlighted inconsistent reporting of age, as many of the studies failed to disclose the intended age range for treatment or if they had the inclusion of participants over the age of 65. Overall, this systematic review and meta-analysis highlights the significant disparities in demographic representation among the participants in atopic dermatitis clinical trials within the United States. The underrepresentation of non-white individuals along with insufficient age reporting, underscore the urgent need for more inclusive recruitment practices. Given the disproportionate impact of atopic dermatitis on non-white racial groups, achieving equitable representation is essential for ensuring that trial findings are applicable to the broader patient population. Thank you for listening to my presentation. If you have any questions, please feel free to email me. And I'd like to give a thank you to Vassar team for helping me do this research and to everyone that worked on this project with me. Thank you.